Hi everyone, I have case study 16, which talks about lung cancer. PJ is a 54-year-old African American who came into the emergency department complaining of a hoarse and husky voice that has continued for the past 2 weeks. There is no pain or tenderness in his throat, and he admits that his normal smoker cough is getting worse. He has been thinking a great deal about quitting smoking in the near future. The patient's medical history includes 27 years with hypothyroidism and a bilateral osteoarthritic knee for approximately 8 years, and he has suffered from depression for the past 2 years. The patient has had several episodes of bloody sputum in the past year, but he hasn't reported it to the doctor until now. He also has an iron deficiency anemia for approximately 8 months, and the cause is unknown. The patient's flu vaccine and tetanus booster are up to date, and he has no prior history of trauma or surgery. However, he does have seasonal allergies. PJ has no family history of lung cancer, but he does have relatives with colorectal cancer, non-Hodgkin's lymphoma, and malignant melanoma. His father worked in a coal mine and died from complications of anthracosis. His mother is still living and has diabetes mellitus and arthritis. All family members seem to be major cigarette smokers, including his wife of 33 years. The patient smokes 1 to 1.5 packs of cigarettes a day, and he has for 37 years. PJ drinks approximately 3 to 4 drinks per week and has resided near a radioactive contaminated site for 25 years. The patient also admitted to snorting heroin a few years ago, but denies any use of IV drugs. Overall, the patient is a slightly overweight African American male who appears in no apparent distress. He is well groomed and appears older than his stated age and is restless. He exhibits no inappropriate behavior and is not guarded about any of his responses. The patient exhibits signs for a worsening cough and onset shortness of breath with moderate exercise, but the patient denies any fever, chills, fatigue, weakness, poor appetite, and unexpected weight loss, or etc. The patient's vital signs show that he has a blood pressure of 125/70, which is a little high. His pulse rate and temperature appear normal, but his respiratory rate is 24 breaths per minute, which is also a little high. In addition, the patient is 5 feet and 9.5 inches tall, weighing 185 pounds. The patient's neuro, skin, neck, head, ears, eyes, nose, and throat exams all have normal findings. However, PJ's lung exam reveals wheezing in his right lung and the upper lobe during inhalation, and there is some resonance to dullness over the right upper lobe as well. His heart and abdomen appear healthy, but his genital and rectal exams reveal a slightly enlarged prostate. Likewise, PJ's blood tests have all normal findings except for his calcium levels are elevated. An X-ray reveals that there is a 3.5 centimeter mass located centrally on the upper lobe of the right lung. The left lung is clear and there is no sign of fluid in or surrounding the lungs. The CT scans reveal normal abdominal and brain tests, but the chest shows that the lesion revealed on the X-rays, as well as in the chest cavity, appears that it is widening and there is slightly enlarged right-sided Hilliard nodes. The left side appears normal. A fluorescent bronchoscopy and biopsies of the lung and lymph nodes revealed that the lung mass is made of squamous cells with prominent nucleoli and keratin pearls. The Hilliard nodes contain squamous cells with distinct nucleoli and are positive for keratin as well. The chest cavity nodes are clear. In addition, the patient's expiratory volume in 1 second is 1.8 liters. In conclusion, the patient is suffering from lung cancer. Alright, there have been several questions regarding this week's case study that have been brought to my attention. Question 1 asks, can cigarette smokers ever decrease their risk for developing lung cancer if they stop smoking? Well, people who quit smoking have a lower risk of lung cancer than if they had continued to smoke, but their risk is still higher than those who have never smoked. Question 2 asks, do pipe and cigar smoking also cause lung cancer? Yes, using cigars and or pipes also increases risk for lung cancer, but not as much as smoking cigarettes. Question 3 asks, does smoking filtered low tar or low nicotine tobacco products offer protection against development of lung cancer? Well, light cigarettes or low nicotine tobacco does not reduce the risk of acquiring lung cancer. The only way to reduce your risk and the risk of others around you is to stop smoking completely. Question 4 asks, what is the pathophysiologic mechanism for hoarseness that develops from lung cancer? In lung cancers, tumor cells can block passageways in the pharynx and larynx, which leads to many symptoms like hoarseness. Also, question 5 states, would you expect wheezing to be more commonly observed in patients with small cell carcinoma or adenocarcinoma, in patients with squamous cell carcinoma or large cell carcinoma? Because large cell carcinomas often begin in the outer parts of the lung, wheezing would be more commonly observed in those patients. because they have large cell carcinoma. Question 6 asks, does disseminated intravascular coagulation, or DIC, is a serious blood clotting issue that is caused by cancer? What are the most common types of lung cancer that are most likely to cause DIC? The most common types of lung cancer would be non-small cell lung cancer as well as metastatic giant cell carcinoma. Question 7 states, why are multiple anti-cancer drugs often more effective in treating cancer than the use of a single drug? In most cases, single anti-cancer drugs cannot cure cancer alone. The use of 2 or more drugs together is often a more effective alternative. Lastly, question 8 asks, what is the panic level of hyponatremia, and why is hyponatremia dangerous? Hyponatremia is a condition that occurs when the level of sodium in your blood is abnormally low. The normal adult values for sodium in the blood is 136 to 145 milliequivalents per liter, so anything below 136 would be considered to be dangerous or a panic level. That's all I have for today. Let me know if you guys have any more questions, and the new quiz study will be posted next week. Have a great day.